Have you ever noticed dark patches on your face that just won't go away? Hi, my name is Kathy, and today we will be discussing melasma, more specifically melasma in Thai women. But don't worry, if you're not Thai, stick around because this could be educational for you too, as melasma does affect Southeast Asian women. Today, we will be discussing what is melasma, what are the causes, symptoms, what does it look like, and how we can treat it. Let's get into it! So, what is melasma? Melasma is a chronic skin condition that causes hyperpigmentation due to an overproduction of melanin, which is the pigment that gives you skin color. It commonly appears on areas on the faces like cheeks, forehead, and upper lips. The dark patches typically shown up symmetrically on both the side of the face, creating a mask-like pattern. A lot of people confuses melasma with post-inflammatory hyperpigmentation, or known as PIH. So let me just quickly explain the difference. PIH occurs when the skin heals after an inflammatory condition like acne or eczema, and it leaves a dark spot. So these spots can result from an excess of melanin production in the response to skin injury or inflammation. So an PIH can fade over time, but melasma tends to persist and can worsen with triggers like sun exposure. Common causes of PIH can be from an overtreating from a laser treatment or a chemical peel or a simple dermatitis. Causes and risk factor of melasma can be varies from chronic inflammation, thyroid disease, hormonal influences like pregnancy, or on birth control pills. However, melasma tend to affect more female. A study in Brazil found 39:1 ratio, as well as a study in India of 321 participants found 4:1 female to male ratio. Okay. Sun exposure. Sun exposure can be the biggest culprit in triggering melasma. According to the Australian government website RPSAN, due to its geographical location and close proximity to the equator, Australia experiences some of the highest level of solar UVR in the world. So how does the sun affect melasma? When UV ray hits your skin, they activate a process called melanogenesis, the production of melanin. In melasma, certain skin cells are overactive, releasing more melanin than usual. This includes cells like keratinocytes and fibroblasts, which are responsible for triggering this pigment production. When UV or visible light hits these cells, they release something called stem cell factor, known as SCF. So the SCF is bind to a receptor called c-kit and melanocytes, which is the cells that produce melanin, making them produce even more melanin. So in melasma, researchers have found that high levels of SCF and c-kit in melasma affected area, showing how this process is more active. In addition, UV rays, sun exposure, produces something called vascular endothelial growth factors, which help melanocytes survive longer, keeping them active in producing pigments. On the other hand, Southeast Asian population have had a reported prevalence of melasma as high as 40%. Southeast Asian women often have Fitzpatrick skin type of 4 to 5, which are naturally more pigmented and more reactive to external stimuli. Remember just then I was telling you about how the sun triggered melasma? Well, because Thailand is so hot all year round, the same mechanism applied. Furthermore, darker skin tones tend to produce more melanin as a defense mechanism against environmental stressors. Additionally, Southeast Asian women may have cultural and lifestyle habits that increase their sun exposure, such as spending more time outdoor, going to temple, going on a motorcycle, a morning roll call, or just generally being mostly outdoor. This, combined with a genetic predisposition, make melasma more common to Southeast Asian women, in this case a Thai woman. So, other triggers such as stress, medication, or heat can worsen melasma. Heat can worsen melasma by triggering inflammatory response in the skin. which directly impacts the cell responsible for melanin production. Remember keratinocytes? Well, it releases inflammatory molecules like cytokines or prostaglandins. These inflammatory signals stimulate melanocytes, the cells that are responsible for producing melanin, to increase melanin production as a response to stress. This overproduction of melanin leads to dark patches seen in melasma. Additionally, heat causes changes in the blood flow by dilating blood vessels in the skin. This increased vascular activity near melanocytes further stimulates them to produce more melanin. In melasma-prone skin, there is often an increase in number of blood vessels, making this effect more pronounced. Heat also causes keratinocytes to release vascular endothelial growth factor, which help melanocytes survive and remain inactive for longer. Symptoms and diagnosis. Process involving visual inspection and possible Woods lamp examination. As mentioned before earlier in the video, melasma can appear symmetric, reticulated, hyperpigmented patches with irregular borders. While melasma is also known as most commonly affected dark skin style, it occurs in any skin types. A dermoscopic examination shown hyperpigmentation in pseudo-rated ridges of the skin. A Woods lamp can be accentuated when the pigmented is epidermal. However, this can be seen with dermal or mixed melasma. Reflectant confocal microscopic has been used to evaluate melasma on the cellular level. So, a differential diagnosis for melasma can be lichen planus pigmentosus, polycleoderma or civet, lentiginous, ephelides, and PIH. Treatment options. There are many treatment options available for melasma. Treatment like chemical peels, laser treatment, or as simply as using vitamin C. Let me tell you how that works. Chemical peel has a keratolytic effect which breaks down the bonds between keratinocytes. It also has desmolytic effects which exfoliate the skin by disrupting intracellular connection, dissolving the bonds that hold corneocytes to the skin surface. This promotes shedding and destruction of tissue to induce wound healing response. This stimulates cellular repair and regeneration. This can also improve appearance of lightening of pigmentation when combined with other therapies. Complication of chemical peel can be PIH, post-inflammatory erythema, or chemical burn. Glycolic peel has smallest molecules that interferes with melanogenesis pathway, reduces the activities of tyrosinase, which is an enzyme crucial for melanin synthesis, decreasing production of melanin. It is recommended to do between 2 to 3 weeks interval, up to 5 minutes for darker Fitzpatrick skin type. TCA peel. A TCA peel works by coagulation of the protein cellular membrane, leads to epidermal necrosis. So, the shedding of the epidermis will have a fewer melanin deposits. This will result in reduction of visible pigmentation. TCA peel also stimulates production of collagen and GAGs, which is a glycosaminoglycan, which enhances collagen production and improves skin texture and firmness. This can help distribute melanin more evenly and reduce appearance of melasma. So, a laser treatment like laser toning, Q-switch, and DIAG has the ability to target melanosomes in melanocytes, keratinocytes, and melanophages. Its short pulse and adjustable spot size are key factor. A 1065 nanometers wavelength is ideal due to deeper penetration and less absorption in the epidermal melanin. Made this an excellent wavelength for patients with darker Fitzpatrick, like Southeast Asian women. So a larger spot size allows for deeper penetration and less scattering of the photons. So this will likely remain within the target chromophore, which in this case are melanin. Laser has a photothermal effect which absorbs laser energy and converts it into heat, leads to the damage of the melanin containing cells. It also has a photoacoustic effect, which is a wave-produced mechanical disruption of pigmented cells, A sudden expansion and contraction shatter the melanin granules into smaller particles that are easily removed by the body's natural process. The heat will need to be confined to the melanosomes where it causes fragmentation rather than the heat dispersing onto the surrounding area, resulting in more melasma. Remember how the heat can trigger melasma? Exactly. So, prevention and maintenance. Managing melasma involves preventing flare-ups. Here's how you can do it. Using sun protection, like broad-spectrum sunscreen with zinc oxide or titanium dioxide every day. Sunscreen can prevent UV light from triggering more melanin production. Using skincare like vitamin C can be crucial. Vitamin C interacts with copper ions at the tyrosinase active sites and inhibits action of the enzyme tyrosinase, resulting in reducing of melanin formation. It also has a photoprotective ability against ultraviolet A. Vitamin C can be applied daily in the morning with sunscreen. Skincare like retinol, or known as vitamin A, can be helpful with managing melasma as well. Retinol helps to stimulate cell turnover of the epidermal keratinocytes and promote a decrease in melanosomes transfer and a rapid loss of melanin. Retinol also helps to alter the stratum corneum and permeability barrier, helping depigmenting agents to penetrate the epidermis more effectively. Additionally, studies show that retinol helps to inhibit UVB stimulated melanin production by reducing tyrosinase activity and melanin synthesis. Retinol should start off slow by using it once a week to see if the skin can tolerate to the agents, then start to increase the usage. Retinol usually applied at nighttime as it can increase skin sensitivity to sunlight. Lifestyle choices. Activities such as excessive exercise, saunas, and unhealthy skin barrier can exacerbate melasma. This can be through inflammation, which is heat, as we spoke about before. Reactive oxygen species is when the skin is being exposed to heat, and this can increase the ROS in the skin and release of oxidative stress and damage skin cells, including melanocytes, leading to an increase in melanin production as a protective response. Disruption of skin barrier, such as prolonged exposure to heat, can disrupt the skin barrier's function, making it more susceptible to environmental stress. Doing activities such as gardening can be really simple by putting on a wide brim hat to avoid any sunlight. Alright guys, that is the end of our video. Thank you so much for listening, and if you have any question, make sure to put it down below in the comment section. And if you like this video, make sure to like and subscribe, and I'll see you next time. Bye!